Could you tell me a little bit about what sort of got you tacked onto this issue? Like what's your experience with mental health hospitals and the issue that it presents?
Well, I've been practicing for 31 years now. It would be 31 years in May. And I did a little bit of research about the whole thing and found out that there was an extensive mental health hospital system in place during the middle part of the 1900s. And then in the 60s, which was actually probably even into the 70s, the whole system just was dismantled, and basically I use the adjective willy-nilly. It just was thrown out. It was just destroyed completely. And anytime you do that, when you completely take an institution that is functioning for better or worse, and there were better times and there were worse times associated with that system. But anytime you just dismantle it completely without any particular reason, then bad things are generally going to happen. And my experience as a intern, a medical student, an intern, and a resident was that there was a large number of people who could have benefited from long-term hospitalization in a good hospital, a mental health hospital, and we're not getting that. Instead, they were in prisons and in jails and living under bridges and in homeless shelters and any place other than places that they needed to be.
Could you talk a little bit about the history of these kinds of institutions and?
Sure. Yeah, there were numerous hospitals all over the United States that were managing and helping mental health patients. Now, with every big institution or big groups of hospitals like this, there's going to be some problems. I mean, humans are humans, and they're not going to be perfect in the way they administer things, and there were undoubtedly abuses that were occurring. But by and large, I think the vast percentage of people that were in these institutions were benefiting from being there. I mean, they were fed, they were housed, they were clothed, and they were provided the treatments that were available. Admittedly, some of those treatments, in retrospect, were probably not the kind of things, certainly not the things that we would use now. But things have changed so drastically since the 50s and the 60s as far as our ability to manage and treat mental health patients. I mean, it's like 180 degrees out now, what we can do compared to what was going on back then. You just completely destroy it instead of, let's say, for example, you might want to reform it. You know, we're kind of big on reforming things in this country. If you don't have something working the way you want it, well, you do something about it, you change it, you do whatever you can to make it better. But you don't just destroy it. And again, this had much more to do with politicians and money. It was an easy way for people who didn't want to spend money on the hospital systems to dismantle it. And that's exactly what happened. So ACLU comes in, says these people are being held against their will, being treated against their will, and they need to be free. Well, that's what they got. But they were free to live under bridges and free to be arrested and put in jails instead of being in a hospital where they could be treated with medication. You know, my thesis right now would be that we need to reinstitute those facilities and use the things that have revolutionized psychiatry. I mean, we've made incredible strides in treating the human brain.
What are some examples of frustrations that you've personally come across that have to do with this issue?
Well, most of my frustration, I had the opportunity to practice in a prison and jail environment. And it was, very obvious that some of the people that I came in contact with in these jails shouldn't be there. They just, they did things that landed them in jail because they had a severe mental illness. So, but my question then was, well, why is this person here? Admittedly, they did, something off the wall and illegal and da-da-da-da, but why are they here and not in a hospital? Because that's where they should be. They should be in a hospital getting medication, and sometimes medication administered whether they particularly want it or not. But being in jail isn't some place that you particularly want or not either. You're there involuntarily, for the obvious reasons. But so why couldn't these people who are in these jails, why couldn't they be in a long-term care facility, getting medication, getting food, getting housing, getting clothed, the whole 9 yards, and then maybe somewhere down the road, when a good regimen of medication and psychotherapy is provided to them, maybe they won't need to be in a jail or a hospital. And that would be the best of all worlds. That I want people to be out and free. That's the whole idea, is that they can function in a world that is pretty complex, and a lot of them, particularly when they're having their problems with symptoms, are not ready to be out in that kind of an environment. But with the right assistance, which can take a while to get there, they could, theoretically. And then there's some other folks that need to be in a long-term facility, and maybe for years, because there's some very, very severe psychiatric problems with certain people. And for better or worse, they need to be watched. They need to be observed so that they don't do things that can endanger themselves or endanger other people. And that's where these long-term care facilities would be very useful. I guess probably what gets to me most is the prisons and the jails have turned into psychiatric hospitals, and I don't think that's a good idea. Because they meet people that need to be in jails and prisons, but don't need to be in psychiatric hospitals. And they get, I think, taken advantage of by the criminals that are supposed to be in the jails, and not the psychiatric patients who shouldn't be.
What's your outlook for any improvement on this issue?
Well, I think some, either nationally or for individual states, they need to take stock of the numbers of people. Number one, they can just go to the prison system and look at the people that are in the prisons and find out how many are psychiatric patients that shouldn't be where they are. Okay.
Is it like non-violent criminals, or?
Yeah, that could be, but even violent criminals. There's you can have hospitals that have different focus of how they treat patients. So you could have a hospital, for example, and the size, I have no idea at this point. I have no idea how big or small it might be. But again, you go through these jails and prisons and look at the people that are in there, and how many are dangerous. How many are just really, really dangerous? And should they be in a prison, or should they just be in a locked psychiatric unit? I mean, in Texas, when I was a resident, they had what we call the psychiatric ICU at the state hospital. And the people in the psychiatric ICU needed to be in the psychiatric ICU. And they were very closely followed, and they were, these were very seriously ill, but seriously dangerous people, okay? And those people exist. Now, the good news is that there's not that many of them, okay? I don't think. I hope not. But it would be a good idea to have those people in one place. With people who are trained to deal with them, people who are trained, doctors who are trained to treat them properly, and to house them safely. That's the starting point. And then you get to the less acute, less seriously ill people, less dangerous people that are in these prisons and jails, and start doing the numbers, crunch the numbers. How many people could you take out of those facilities and put them someplace where they'd have a little more freedom, but get good treatment? And the treatment in the prison system is, they get some, but it's usually with the older drugs, for example. They don't get the good stuff, so to speak, okay? They don't get the good stuff. They get what's left over, a lot of them. So that's not gonna, why not use the good stuff? Because they might actually get better and maybe function a little bit better in society. So, again, you gotta look at the numbers of how many people are in places where they shouldn't be, and then you say, okay, how many facilities do we need to handle this number of people? What do we have already? What do we have to build? Do we have to build anything? And my guess is we probably need to build some things. It might not be some big, huge number, but but you have to staff it, and you have to have people that, doctors, nurses, and technicians, and whatnot. And it's going to cost money, and that's, as always, the big bugaboo is, where's the money going to come from? Show me the money.
Is there opportunity to save money from shunting to the prison system and instead putting it towards this? And is there a long-term?
Well, theoretically, that's exactly right. If you've got people that are taken out of the prison systems, which and when you're in a prison, you're a complete ward of the state or the local government or whatever. So they house you and they feed you and they do all the things, and it's complete money thrown at that system too. And it's pretty expensive, because you got to pay police officers and all the trappings that go with the legal system too. So it's not like it's gonna cost that much more to have a hospital system. And then you have the added possibilities that some of these people will stop offending, which caused them to be in the jail and the prison to begin with, and then you don't have to they might, actually live on their own, or be in a much lower acuity sort of situation, and it's gonna cost a whole lot less for the state to manage them, okay? So, you could theoretically save a lot of money by not having these people in jails, so that's a savings to some extent. If you get some of these people out of these environments and get them so that they can, because sometimes people in these long-term care facilities where they're working, they're under supervision, usually, but they can work in a restaurant, they can wash dishes. I got patients that have some pretty severe mental health problems, but they wash dishes 4 hours a day. Well, that gets them out, gets them doing stuff, keeps them busy, and they're happy. They can do the job, and they're happy that they can do that. They get a certain amount of satisfaction that they're actually functioning. It might not be rocket science or anything, but it's something.